first speaker is Associate Professor Ashley Bean. Dr. Bean is an emergency physician and a faculty at the University of Arkansas for Medical Sciences. She has an adjunct faculty appointment in the Division of Academic Affairs in the Office of Global Health, and she's a member of the Division of Emergency Ultrasound. Dr. Bean's talk will be about end-of-the-road ultrasound. So it's my pleasure to introduce Ashley Bean.
Thank you. So this is a great privilege today to talk about the value of ultrasound in low-resource settings. My objective today is to simply convince you that ultrasound is an incredibly cost-effective tool for improving healthcare in low-resource settings. It has several advantages. It's safe, it's portable and easily installed, it's inexpensive when compared to other imaging modalities, it provides rapid and timely knowledge, and it can be used by a variety of healthcare people in a variety of healthcare settings. The largest advantage is that it has a very wide array of clinical applications, and I'm just going to touch on some of those later on during the lecture. When I'm talking about ultrasound, I'm talking about goal-directed ultrasound that asks a specific question. Is there a baby in the uterus? Is there blood in the abdomen? This is ultrasound that's performed at the bedside by the clinician taking care of the patient. So the first advantage, ultrasound is safe. After decades of use, there has been no known instance of human injury due to diagnostic ultrasound. We're done with point one. So ultrasound is portable and easily installed. Here's a conventional X-ray setup. It's not portable. It requires quite a bit of infrastructure to be able to use this X-ray setup. Same thing with a CT scanner. Ultrasound is portable. When you reach the end of the road, but you haven't reached the end of your journey, you can put the ultrasound in a backpack or in your canoe and continue on. When speaking relative to other diagnostic imaging modalities, ultrasound is cheap. The main capital expenditure is, of course, your ultrasound machine. These portable machines cost somewhere between $25,000 and $75,000, although there can be some refurbished machines available for about $5,000. And as far as repair costs, bringing a technician in is sometimes quite expensive, and so you can actually just pick up the handle, pack it in a box, and send it to the company or to a technician somewhere. The operating costs, you have to have electricity for this to work. It does require only a simple power supply and can even run on battery power. If you choose to store the image, you have to pay for some type of storage device. This can be a flash drive, a thermal printer, or DVD. The main ongoing operating cost is going to be the ultrasound gel, and that's less than $10 a liter, and you only need a few ounces for each exam. The fantastic thing is that there are actually some local substitutes that can be used, so you don't even have to buy the ultrasound gel. Local oils can be used, and then there's a recipe where you can make ultrasound gel from cornstarch. Furthermore, ultrasound can be used in a variety of healthcare settings. These authors looked at the impact of introducing ultrasound in rural Rwanda, and they found out that ultrasound training changed patient management, that the program was sustainable, and that the reads were accurate. In addition, ultrasound can provide rapid and timely knowledge. This lady comes into clinic, and I perform an ultrasound, and she's happy and takes a picture of her beautiful child. On the other hand, this patient comes in, and we see this. So this is a molar pregnancy, and it's actually can become a rare form of cancer, and this lady needs to be referred to a specialist. Ultrasound can also be used by a wide variety of healthcare providers. It's not just for radiologists. So surgeons and critical care doctors and even eye doctors use ultrasound. The great thing about being an emergency physician is I get to do all of this. So physician performed ultrasound. You say that's great if you work in the United States, where there are over 5,000 physicians working per 100,000 people. But what if you work here in Uganda, where there's less than 1/100th of that physician workforce? So these authors, including someone who's at the table here, looked at point-of-care ultrasound and training for non-physician clinicians in resource-limited emergency departments. And they found it was teachable, sustainable, it changed management. And here is my most important point. Ultrasound can be used for a wide range of clinical applications. We've touched on this topic already of the top 10 leading causes of death. And what I'm going to show you is how ultrasound can diagnose the disease, determine the severity, or identify complications of all these causes of death. Ischemic heart disease can cause congestive heart failure. A stroke can be caused by carotid artery occlusion. COPD or asthma can be recognized by these characteristic repeating A lines on ultrasound. Lower respiratory tract infections look like this pneumonia, and lung cancers can look like this lung mass. People with AIDS have a higher percentage of extrapulmonary tuberculosis, which can be suggested by this enlarged lymph node. Diarrheal diseases are very common, and you can assess your patient's volume status by looking at the inferior vena cava. Infections like this abscess are a common complication of diabetes, and ultrasound can show you the extent and the depth of the abscess. Road injuries, over 90% of road traffic deaths occur in low and middle income countries. And the patient who comes in and has blood in their abdomen, you know that person needs to be referred to a surgeon rapidly. And finally, a common cause of hypertension, a common complication of hypertension is aortic dissection, as is seen here. So in conclusion, ultrasound machines are safe, portable, easily installed, and relatively inexpensive. Goal-directed bedside ultrasound can be taught to those healthcare providers that are in the front lines of providing patient care. And ultrasound imaging can help diagnose a wide range of diseases or disease complications, including those on the top 10 leading causes of death.